Okay, let's get more on this from Tamara Alrifai, who's in Amman, and she is UNRWA's Director of External Relations and Communications, and greatly appreciate you taking the time at this very awkward time for you, I am sure. Could you just explain for me, what is the reality of this? So Israel says we're not going to have any contact with UNRWA or anyone who deals with UNRWA anymore. So they feel as though they're effectively shutting you down. In real terms, though, on the ground, for example, can UNRWA staff continue to distribute aid in Gaza, for example, that is there now? Can they do that?
Yes, for now, UNRWA staff in Gaza continues to be the largest staff corps of a humanitarian agency. You've said it all in the report that preceded my intervention about the scale and scope of the life-saving operations and services that UNRWA provides in Gaza. But UNRWA is also an entire network of schools and health centers in the West Bank, including East Jerusalem. So what you're referring to, the ban by the government of Israel on UNRWA's operations, and also the ban on Israeli officials to contact UNRWA, right now is difficult to evaluate. What we've heard, because we've not had direct communication from the government of Israel, what we've heard is clearly the intention to expel UNRWA from our offices in occupied East Jerusalem, a prime real estate location in East Jerusalem in Sheikh Jarrah, the famous neighborhood, where UNRWA has been operating for over 70 years. But meanwhile, our colleagues remain in the West Bank and remain in Gaza. And in Gaza, UNRWA remains the largest aid agency.
So it sounds like, for example, whatever aid is in Gaza, maybe that can still be distributed. But it also sounds like new aid won't get in, because if Israel's controlling the borders around Gaza and it's not going to have contact with UNRWA officials, they're just not going to let anything in. Is that how you understand it?
This is what we are yet to see. That ban on UNRWA and on contact with UNRWA effectively starts tomorrow on the 30th of January. So we are yet to see how it's going to be implemented. But for now, it's really worth highlighting again the huge role that UNRWA plays in Gaza, not just by bringing in 60% of the aid, but also by being the agency that is very much trusted by the population in Gaza. 13,000 UNRWA staff in Gaza have been the doctors, the nurses, the sanitation workers, the teachers, the shelter managers. Almost everyone in Gaza knows someone who works in UNRWA. So that level of being part of the community also gives UNRWA full access to the people of Gaza and gives UNRWA an opportunity to play a much bigger role than an aid agency, providing education, providing psychosocial support to traumatized children and grown-ups. So this is really more than an emergency operation. It's being part of the everyday life of a Gazan by facilitating their access to medical services, primary health care, vaccination, and also education, and so much more.
As you explained, it's the lifeblood, it's food, it's medicine, and it's education. Israel clearly doesn't trust UNRWA, wants it closed down, and by passing these laws, that's what it's attempting to do. It's been suggested that Israel wants to take the services provided by UNRWA and have them passed on to other aid agencies. Is that feasible? Could that be done?
I think it's better to ask other aid agencies whether they are able, whether they have the resources, whether they have the staff to run services that are closer to public services. The answer is no. No other UN agency can run daily services that look and feel like public services. No other UN agency has a full-fledged primary health infrastructure with the primary health centers, the vaccination, the reproductive health services, the services to pregnant and lactating women. No other UN agency or international non-governmental organization, for that matter, has the infrastructure for a gradual return of students to learning and hopefully to schools. Talking about 650,000 traumatized children in Gaza, half of whom used to go to UNRWA schools before this war. So UNRWA is irreplaceable, especially in these type of public-like services. Some of UNRWA's services, like food distribution or like managing shelters, could be replaced by other UN agencies with that kind of experience. But it's truly the everyday services, primary healthcare and education, that no one else can replace UNRWA.
Tamara, really appreciate you coming on. Thank you so much. Tamara Alrifai, who's the Director of External Relations and Communications for UNRWA.